My name is Christy Wasserman, and I am a nurse with special training to help patients with stomas. Today, we're going to be discussing peristomal skincare, and chances are, if you're sitting here, you either have a stoma or you're with a loved one and you help take care of their stoma. Either way, today we're going to go through some quick tips and tricks about how to take care of the skin around your stoma, also known as peristomal skin. Welcome to the group discussion. Please notice the whiteboard to keep up with today's plan. The products you see on the table are important for today's discussion, but don't worry if you don't know what they are or how to use them. That's what I'm here for, and that's the whole purpose of today. Up on the whiteboard, you'll see my name, again, Christy Wasserman, and I have a bunch of letters at the end of my name. So I'll explain what they are just so everyone understands and knows. So the BSN means that I have a bachelor's in nursing. RN is that I'm a registered nurse, and CWON stands for Certified Wound and Ostomy Nurse. If you notice under today's plan, I have listed what we're going to be doing for the next hour. And one of the things we're going to be talking about is what is a WOCN? So while the initials and the letters are a little bit different, we actually do the same thing. So we both basically can take care of patients with ostomies. So in the next few minutes, I'll explain what a WOCN is. But for me, I am just certified in wound and ostomy care, not the other part. So stay tuned and let's get started. So what exactly is a WOCN? A WOCN is a wound, ostomy, and continence nurse with special training to help patients with certain complex wounds. They also work with people who have stomas, who use pouches to collect urine or stool. And then the continence part helps people with issues such as urine leaking from your bladder. Usually patients meet with a stoma nurse before they leave the hospital. It is important to find a local WOCN if you have a stoma. The WOCN is there to help with any peristomal skin issues. They help find the right size pouch for you, and they could also serve as a really great resource and general support for you and your family. So now that you know what a WOCN is and what they do, where can you find them? Well, a good place to start is to first contact the surgeon who made the stoma. Surgeons who make stomas work with WOCNs all the time. And again, before you left the hospital, you should have met with one. So you could usually contact the surgeon and they can help point you in the right direction. Another option is to contact your insurance company, and WOCN services usually are covered by insurance companies. And another place is you can go to www.wocn.org, and they can help you find a local WOCN no matter where you are across the country. Okay, so now that you know how to find a WOCN or stoma nurse, now I'm holding two products in my hands that are very important for if you have peristomal skin issues. Again, you saw these on the table earlier, but if you know what they are, please raise your hand and then just share with me what the products are and how you would use them. Don't worry if you don't know how to use them. Again, that's the whole purpose of this session today. And hopefully you'll have a little bit more knowledge by the end of the session and feel a little bit more comfortable with how and when to use these products. The main goal of the teaching session today will be for all the participants here to be able to identify and describe common causes of peristomal skin complications and how to effectively treat them. So what would be one of the main reasons why somebody would get peristomal skin issues? Well, first it would be because of urine or stool laying on the skin for too long, some skin conditions such as eczema and psoriasis, patients undergoing chemotherapy, and basically anyone with a stoma is at risk for getting skin breakdown around their stoma. One of the best ways to prevent peristomal skin issues is to make sure your pouch is the right size. This is the main reason why patients have peristomal skin issues. When the pouch does not fit properly, stool or urine can leak on the skin and cause redness, skin loss, and irritation. A barrier ring will help to make a good seal around the stoma and help prevent urine or stool from leaking onto the skin. Now, we're going to watch a very short video on how to properly apply a barrier ring around your stoma. If you're not doing this already, once again, this is a really good way to ensure a really good fit around the stoma. Also, this video will be sent to everybody here in the group today. So just in case you forget what we've learned, it'll be available to you when we send it to your email. So you can easily watch it whenever you need to. Mold and stretch the ring to the desired shape. Apply the ring and adjust the shape again if necessary. Smooth the outer edge securely onto the skin. So the first thing you need to do to look at the skin around your stoma or look at the peristomal skin is to first remove the pouch. Remove the pouch slowly and carefully. Make sure to inspect the skin, and the most important part is the skin around the stoma should look like the rest of your stomach. The next step is to clean around the stoma with water. No soap is needed. Pouches should be changed at least every 3 days, especially if you have a pouch for urine or very liquid stool. Remove the pouch, look at your skin, clean with tap water. Simple enough? Great. Now let's move on. So 6 to 8 weeks after your surgery, the stoma should not change in size. However, gaining or losing weight can change the fit of your pouch. So if you are having any leaks from your pouch or your skin is irritated, it might be a good idea to just re-measure your stoma with a measuring guide to make sure that your pouch fits properly. Some people have hair on their abdomen. In order to create a good seal between your skin and the pouch, sometimes it is necessary to trim the hair on your abdomen. The best way to trim the hair is to use a buzzer or even a beard trimmer. Use the buzzer in the same direction of the hair. The main reason to trim the hair is so you don't irritate the skin when removing the pouch. Pulling the hair away from the skin when removing the pouch can irritate it or cause an infection. Here are 2 pictures of stomas. One has normal peristomal skin and the other does not. The skin around your stoma should look like the rest of your stomach. Every time you change your pouch, stop and look at the skin. If the peristomal skin looks like the rest of your stomach, then go ahead and apply your pouch as usual. Remember, once you apply the pouch, hold your hand over the pouch for at least 5 minutes, or you can use a hair dryer on a cool setting to seal the adhesive. This will help your pouch last longer. If you remove your pouch and the skin looks red, irritated, or the skin feels like it is burning, do not apply the pouch. Stop and perform the crusting technique. So what is crusting? Crusting is a technique used only when the skin around the stoma or peristomal skin becomes red, irritated, or has skin loss. Crusting is not done if peristomal skin looks normal. How do I perform crusting technique? Well, crusting can be done in 3 easy steps. Apply, dust, and crust. That's all you need to remember. In order to perform the crusting technique, you will only need 2 items. The first item is stoma powder. All the companies that make pouches make stoma powder. There is not one in particular that we recommend. It's what you prefer. The next thing you're going to need is Kevlar No Sting Barrier Film, also known as Skin Prep. Now that you've learned about crusting technique and are a little bit more familiar with the products to use, let's watch a short video on how to do crusting technique.
This video will demonstrate how to care for the skin around your stoma if it's irritated. The skin around your stoma should look just like the skin on the rest of your body. If you notice an open area around the stoma, your skin is irritated. This can happen if you have leakage from your appliance, because stool or urine will come into contact with your skin. If you develop skin irritation around your stoma, we recommend you use Stomahesive powder and no sting skin barrier. First, remove your old appliance. And clean your skin with water, then pat it dry. You need to remeasure your stoma to make sure your appliance fits properly, because the shape and size of your stoma may change over time. If your stoma size has changed, you'll need to trace the new measurement on the back wafer you use for your new appliance. Now apply Stomahesive powder to your irritated skin, making sure to brush off the excess powder using a paper towel. Dab the powder on using an up and down motion with a no-sting barrier wipe. This is called the crusting technique, and it will lock in the powder. Put the new appliance over your stoma. Make sure to use the new wafer that you measured. Once your skin has healed, be sure to stop using the powder. If your skin is still irritated the next time you change your appliance, contact your doctor or wound ostomy continence nurse. If you're in the hospital, tell your nurse.
Now that you've seen the video, let's review. Remember to always look at the skin around your stoma after you remove the pouch. This is a very important step. Make sure to wear a barrier ring before you apply your pouch. This will ensure you get a really good seal and that no excess urine or stool will leak out onto the skin. Remember to measure your stoma if you find that you're having more leaks than usual or if your skin is getting red or irritated. And for those that need it, trim hair on the stomach with a buzzer. And don't forget, when you crust, apply, dust, and crust. And you can always contact a local WOCN if the redness or irritation does not go away. Call us, let us know. We would love to help. That's what we're here for. So now that we're pretty much at the end of the session, once again, I have these two products in front of me, and now I'm sure that you hopefully are a little bit more familiar with what they are and what they do. So once again, I would like to go around the room, and if anybody would like to volunteer, we'll start with you, and then I just want to see if everybody knows what these products are and how they should be used, and when you should stop using them. Great job, everyone. It seems like everybody pretty much knows what these products are, how and when to use them. So it sounds like everybody is on their way after this session to go home and take care of their peristomal skin without a worry. And if you ever forget what you learned in today's session, I will be sending this entire presentation through email, should anybody need to use it for any reference. Also, please don't forget to take the brochure on your way out so that you could also have a little guide about what a WOCN is and a little reminder on a piece of paper about how to perform the crusting technique. If you have any questions about what you learned today, you can always email me at s1320267@monmouth.edu. I'd be happy to hear from you and always happy to help. Thank you.